Hi everyone, Dr. Peterson here with Regions EMS for today's COVID update. Today is, I'm not sure. Today is Thursday, April 23rd, 2020. Information presented today is current as of today, will not necessarily be current as of tomorrow. Stay tuned to our website, regionsems.com. Click on the COVID page and you'll find all sorts of resources that are time-stamped so you know that we've reviewed them and you're getting the most recent up-to-date information. There's also a very helpful frequently asked questions section that truly contains questions that we get asked frequently. So please review the website. It might answer a lot of your questions. That said, we're always happy to help anyone out, give any recommendations if it's within our scope of practice, and answer any questions you may have. regionsems@healthpartners.com is the best way to reach us. All right, what's the data today? Worldwide, I'm going to give you exact numbers instead of round off today, just for something a little different. Worldwide, 2,658,062 confirmed cases, with 184,643 deaths related to COVID-19. In the United States, we are at 843,614 confirmed cases, with 46,838 deaths attributed to COVID-19. So that makes up just about 25% of the worldwide deaths. Minnesota has 2,721 confirmed COVID cases with 179 deaths, and Wisconsin, 4,845 cases with 246 confirmed deaths. I fully expect that the Minnesota numbers will jump significantly due to the recent agreement between the University of Minnesota, the Mayo Clinic, and the state to expand testing capabilities. As we test more people, we're going to find more infections. Like we've said before, we're not testing symptomatic patients currently unless they need to be hospitalized or if they are a frontline healthcare worker. So I think by expanding the testing, we're going to find a lot more cases and that number is going to jump. How do we interpret that? Nobody knows, but we'll deal with that in the coming weeks as the testing rolls out. All right, I have a few important things to talk about today. First of all, like I said, there is a new agreement between the University of Minnesota, the Mayo Clinic, and the state of Minnesota. Unfortunately, Wisconsin, I'm not aware of any similar agreements yet, but at least in Minnesota, they plan to have the capacity in the coming weeks to test up to 20,000 people per day, which basically means we'll be able to test whoever we want. And this means that we'll have a much better handle on where is the virus out in the community, how is it spreading, who is it spreading to, and keep a closer eye on some of the healthcare workers and essential employees so we can start to really reopen society and our economy again, knowing that if you're infected, that you really do need to isolate and stay home rather than keeping everyone home like we're doing right now. There's been several questions about the antibody tests that have been reported out there. I know, for example, the city of Detroit has received a whole bunch of tests from Abbott Labs, which is a very reputable testing company that our hospital labs use their products for a lot of tests. And the goal was to test all of the Detroit police officers with the new rapid antibody test to figure out who was infected and who was not. Unfortunately, there is a lot of variability with these tests, and with that specific antibody test, it was only truly accurate if you tested somebody at least 2 weeks after their symptoms first developed. So that's not helpful at all for determining right now if I've been exposed, do I need to stay home or can I continue to work? So I would just urge caution. Even the tests that the University of Minnesota and the Mayo Clinic are using will be antibody tests, and so may not necessarily be very helpful in the early phase or looking at exposures to see who may become infected and who may not. But that's part of the work that's going to be done with these tests, is to help figure some of that out. So I would not necessarily recommend going out and getting a whole bunch of antibody testing kits, because what do you do with that information? We don't know. One of our health partners, chief medical officers, has produced a very helpful document on these antibody tests that is posted on our website, as well as a lot of information in our frequently asked questions section about these antibody tests that may be worth your time to review as more questions come up. On those notes too, we're getting some reports, seeing some things in the ED. There is a little bit of laxity with some of the PPE usage. Masks, fine, but there's more than just the masks that are recommended for some patients. eye protection, obviously gloves, that's pretty universal, gowns for the highly suspicious patients, and wearing masks all the time, even in the station, and obviously for every single patient encounter, whether or not it's a COVID suspicion or not. We have had some cases where patients were transported to the hospital for other reasons and found to be COVID positive. If we don't take precautions on all of these patients every single time, we're not going to know, and then we're going to open ourselves up to a potential high-risk exposure, which means you will be out of work for 14 days. And especially around the station too, we just want to prevent that asymptomatic transmission. I know there are some agencies that are probably doing better at that than others, but I would just encourage everybody, wear a mask at all times, even in the station, even in the common areas. And for now, still, we need to avoid congregating close together, spending significant amounts of time close together. So just use some common sense, plan out your day, work around your coworkers, and let's prevent the spread of this virus. But PPE, do not neglect your PPE. Trauma team activations at regions, we've talked about this before, but they're still working through some of the team makeup at regions, who's going to respond. A lot of it is going to depend on the report that you give to MRCC. So obviously these will be red patients that you'll be reporting in. We ideally would like a set of vital signs, the mechanism of injury, and any current interventions that you've performed. You may be asked some additional questions such as blood thinners, that kind of thing. But there is a chance that the trauma team may not fully respond, even if you request a trauma team activation, based on the information that you provide. Trying to limit the number of people that have to gown up and dress up to go in the room. And so in some cases, there may be some judgment on the hospital side to not fully activate the team. So just keep that in mind, be aware of that, don't be upset by that. We're just trying to do the right thing for as many people as possible here. We are also hearing that there's some confusion out in the general public that maybe some ERs are discouraging people from coming in, or some EMS agencies are discouraging people from going to the ER. Let me just be clear about that. Right now, we are not in crisis mode for our pandemic response, which means that we should be treating and transporting everybody as per we would outside of a pandemic. All of the emergency departments are open for business, and if people have an emergency or think they have an emergency, they should seek care at a hospital in an emergency department. We should not be refusing treatment or transport to people. There are those few rare exceptions where it's an asymptomatic patient who only wants to be transported because they're concerned about COVID, assuming that their vitals are completely normal. I think that's worth a discussion with medical control to help make that decision. But in general, we should be treating and transporting everybody who wants to be treated and transported, and we should not be discouraging people from seeking care at an emergency department if they think they have an emergency. We need to dispel that myth that's out in the community right now that hospitals are not open, that emergency departments are not open. That is just not true. And then finally, at least at Regions Hospital, we are doing some in-house testing of some patients that is being resulted much more quickly than some of the other tests that we've been doing previously. And in some cases, we are getting positive test results before your PCR is available to the hospital. What we're trying to do is notify the pre-hospital EMS crews as soon as possible when we get those positive test results. So if you haven't uploaded or completed your PCR in a timely manner, it may delay, or we may miss out on that opportunity to notify you or your agency about a positive test result. So I would just encourage you, if you're transporting, just in general, it's a good idea, but specifically for those high concern for COVID infection, get your PCRs posted quickly so that those reports are available when we get those test results back so we can let you know. Okay, that's a lot of information for today. All of this is posted in a summary document on our websites. I would encourage you to check that out. A lot of questions I think can be answered from that page. Let's go back to Tuesday's trivia question. The question was, Amazon removed or blocked how many products for claiming to treat or cure COVID-19 or for price gouging? Was it A, 200,000, B, 500,000, or C, more than 1 million patients? The answer was C, not patients, products. The answer was C, more than 1 million products that Amazon has blocked or retracted because of either false claims about curing or treating COVID-19 or for price gouging, such as the infamous toilet paper roll price gouging situations. Shout out to several people here who got this right. Colleen Dollinger from our very own Regions EMS was correct. Let's see, Tracy Peterson from Spring Valley Area Ambulance. Brian Mueller from Washington County Sheriff's Department. And then we did have a submission through a separate email address. I don't recall who that was, and I don't have access to that information. I apologize. It's best to send your answers to regionsems@healthpartners.com. We can compile everything and give you a shout out. All right, let's move on to today's question. Again, any guesses, send to regionsems@healthpartners.com. Also, if you don't see your agency on our patch board, please send us a copy of your agency's patch that we can post on our COVID Warrior patch board as well. So here's today's question. I'm going to give you 3 possible answers here. 2 of the 3 have been cited by the FTC, the Federal Trade Commission. Who of these 3 was not cited by the Federal Trade Commission, Food and Drug Administration, and/or state authorities for peddling bogus COVID-19 treatments? Was it A, televangelist Jim Baker, B, radio star Rush Limbaugh, or C, InfoWars host Alex Jones? Again, send your responses to regionsems@healthpartners.com. Any questions, concerns, comments, also to that same address. Thanks for watching. Thanks for the feedback you've been giving us. Hopefully these videos have been helpful and give you a consistent, credible source of information. Stay safe, stay healthy. We'll talk to you next week.